Dr. D, mom of three. I am so excited to be here today with you. I'm so excited that you're tuning in also. It's been a while since I posted. There's been a lot going on. Our family has been in transition. We relocated. So if you've ever moved, you totally get it. And I don't even need to help you understand what's happening here over the past few months. So there has been a big transition. So thank you so much for everybody who has sent me an email, has commented on my videos. It's meant so much when people have said that they really missed my videos and that they really thought my videos were helpful. That means a lot to me because that is the goal of the Dr. Mom Show, that I give you some medical information and it serves as a medical source for you so you can have a better conversation with your physician or your child's physician. With that being said, please remember that the Dr. Mom Show does not take the place of your physician or your child's physician, so always seek medical advice from them. Again, this is just so you have a reliable resource to come to learn about things. So a lot has happened. I am so excited. Since the last time I spoke with you, if you've been keeping up on Facebook with the Dr. Mom Show, you know that I've been featured in a few magazines, been on the cover of some magazines, including Sheen Magazine, Miss CEO, Formidable Woman. I've been on some podcasts and radio shows. One was with Miss Tammy. The other one was with Dr. Dina Brown, Walking Through Glass. I mean, it's been amazing. It's been a great few months. God is doing amazing things with my life, and I'm so thankful and I'm so blessed. One of the other things that has happened, and I'm totally going to get into our topic, but I'm just so excited. But one of the other things that has happened is that I have published my first book, and it is called Mom, M-O-M, and it stands for Meditate, Overcome, and Motivate. And it's a 30-day women's devotional journal, especially for mothers. So if you haven't gotten one yet, or if you're interested, you can get on my website. It's www.delenemushalak.com, my name. You can check it out. I love it because it's just a reminder that as women and as moms, God has promised us so many things, and that we're loved, we're strong, we're favored, we're beautiful. And it's just a reminder of those things, because a lot of times we put everybody else in front of us and we forget about ourselves, and we forget how strong we are, and sometimes we can get down in the gutter. So definitely get that for yourself, or for your mom, or grandma, aunt, a colleague who you feel could use it. It's also a little workbook. With one of my shows, I'll probably be reading from it, so I am excited about that. The other thing is my first children's book is coming out. Whoop whoop. It's called The Tripsies and Me. Everybody knows who the Tripsies are if you've been following me. If you're just joining me or just subscribing to the channel, the Tripsies are my triplets. They are now 3.5 years old. Baby Luke, Ethan, and Alina. I love these three so very much. They are amazing. I feel so blessed to be their mother. So much has been happening with them, and they're growing so fast. You'll see them in, of course, the Tripsy clip of the week. So again, I am so excited. Don't forget to hit the subscribe button at the right of your screen, and I'll delve right into today's topic. So today we are talking about not the H word. Who said the H word? So this is all you need to know about HPV. And if you have not heard about HPV on a commercial, HPV stands for human papillomavirus. And as the word includes, it is a virus. And today we will talk about what HPV is, how you can get it, how you can get screened for it, possible ways of prevention. So it is really, again, just a learning tool. And I do encourage you, especially if you're a younger person, maybe starting to become sexually active or even not sexually active yet, to speak to your provider. If you have a child who is an adolescent, a teenager, or getting ready to go to college, definitely talk to your provider about it. I'm sure they will bring it up. So the human papillomavirus, or HPV, this is insane. There are over 200 types of this viruses. Scary. The other scary fact is these viruses can cause cancer. Bigger scare, bigger yikes, because who wants cancer? Not this girl. I don't want it in my family. I don't want it in my body. I don't want it in my friends. Nobody. I don't want it for you. I want you to be healthy and strong. So you don't want this. The other scary thing about human papillomavirus, I will be calling it HPV, because try to say human papillomavirus 3 times very fast, not easy. But the other big thing is that people don't know, but HPV is considered a sexually transmitted infection, or STI. Back in the day, it was known as a STD, sexually transmitted disease. So if you want to be cool and with the times, they are called STIs now. It is the most common, what we call anogenital. And when we say that word, that means it's the anus, your bottom, and the front part for boys and girls, the most common STI that is contracted. So this is some scary stuff. So this is something that you need to read about, you need to know about, whether you're an adult or you have kids. So this kind of goes across the board, which is what I do, internal medicine and pediatrics. So this is why I love taking care of everybody, because I get to educate you about these things. Now, with the types, they are separated into subtypes, so you know exactly where they can occur. So probably the one that's very common is that it can occur on your skin. And these can be seen especially in little kids. You know, little kids have like warts on their fingers, sometimes under their feet. We call them plantar warts. Sometimes we'll see them on their knees, their hands. Some people will have them on their face. And these are common warts. These types of warts, again, because they're different types, there's different strands. And I know, or strands, whatever you want to say, strains. And it's kind of like the flu, that when they try to get the vaccine that covers that type of flu, because there's so many different types. So that the type of HPV that causes common warts, thank goodness, is not cancerous. But then there's what we call like anal and genital warts. And this can affect the testicles, the penis, the scrotum, again, testicles, and the anus, the rectum, the anal canal or wall inside. So even like inside, you can get stuff going on there. Ah, cool. A lot of those types that people have down there, we've heard about genital warts. Nobody wants genital warts. And just, you know, genital warts can look like almost like cauliflower. Have you ever seen cauliflower? It's kind of like irregular borders. It's not smooth. It's a little rough when you feel it. Like if you've ever had a common wart or have a little kid who has it, you can feel it's rough. So it's kind of like that, but even uglier, because warts are definitely not pretty. So nobody wants them down there in your area. But the horrible thing is that the ones that are genital warts are totally at increased risk of causing cancer. So again, we do not want that. The other one can occur in other, what we call mucosal surfaces, and I've talked about this before. When we talk about the mucosa, as you know, our lips, for example, you can tell that there's different skin that's inside, on the inside lip versus the outside, but right here is a little bit more tender. We talk about mucosa when we talk about inside our eyes. You see my eyeball, or inside the nose. Again, when I've spoken about infections and infections spreading, we've talked about those quote unquote mucosal surfaces that, you know, that's why we tell you not to like lick things or don't pick your nose, because if you touch stuff you can contract different things. So some of them can occur in these what we call mucosal surfaces. So again, the oral pharynx, again the back of our throat is pharynx. So again, can you believe having that stuff in your mouth? Not cool at all. So how is this spread? So it is spread by skin to skin contact. So touching, rubbing, all up in there. So try not to rub against people that you do not know or you are not familiar with, because that for sure is not cool and you are not sure exactly what is on their body. So you definitely don't want to do that. So please don't. Again, remember, kids for sure can have these common skin warts, and most of those go away. And again, just to reiterate, those common warts are usually non-cancerous. So again, when you see little kids on the warts, we usually freeze those. again, with liquid nitrogen, if you've ever had that done. It is super cold, and it kind of stings a little bit. Sometimes it can blister up, but that's normally what they do for kids. You know, there's stuff that's over the counter for wart removal, and that's almost like quote unquote like burns the warts. Again, that's what we do with the liquid nitrogen. So those are easily taken care of. So next up, I'm going to show you a little Tripsy clip. So enjoy this Tripsy clip of my baby loves.
You're a bad spider.
Aren't they super duper quadruple cute, like Tripsy cuteness going on there? So again, before I get back into our topic again, not the H word, all you need to know about HPV, aka human papillomavirus. Don't forget to subscribe, hit the button on the right side of your screen. So next up, let's talk about the risks of getting HPV, human papillomavirus. What are some risk factors? So one, if you have been or are currently sexually active with multiple partners. So of course, the more people you are having sexual activity, or the medical term for that is coitus, with, that increases your risk. I know you've heard that saying that if you sleep with somebody and they've slept with 10 people, you have also slept with all those people. And that is so true when it comes to STIs and different infections that can be transmitted through sexual activity. Because the unfortunate thing is sometimes with some of these infections, people don't even know that they have it. So if they contract it from somebody else, they're carrying it, they don't know they have it, now they've slept with you, and you could potentially contract it, and you know, unfortunately they didn't know and they weren't able to tell you, for you to make a decision whether you wanted to take that chance or not. So of course, the more partners you have, that increases your risk. It's also been shown that patients who have HIV are also at higher risk of getting HPV. Again, this is why, as far as with sexual activity and multiple partners, it is important to use contraception and condoms when or if you are being sexually active with multiple people. Of course, I would probably just recommend abstinence, and you know, always encourage a monogamous relationship, because there's so much stuff that goes on. And again, I think what's tricky is that some of these infections, people don't even know that they have it. You know, this can happen with HIV, hepatitis, herpes, HPV, chlamydia, gonorrhea, syphilis. So I mean, all these diseases you can contract by sexual activity, and the partner who initially has it and is carrying the disease may not know that they have it. So you definitely want to be careful out there, okay? So again, Dr. G encourages abstinence. That's for sure is what I'll be telling my babies. So don't try and get up on my babies when they get older, boys and girls. So let's move on. So next, the types of cancer. I talked about that HPV unfortunately can cause cancer. So it can affect a lot of the parts of our body. So one, again, it can cause oropharyngeal cancer. So again, of the mouth, it can cause cancers. The biggest one, or type, I should say, is squamous cell cancer. It can cause cancer of the penis, cancer of the anus, cervical cancer. That is the number 4 most common cancer in women. And I know you may think like, oh, you know, 1, 2, 3, 4, that's not bad. But again, who wants cancer and who wants cervical cancer? So those are big. So again, like I said, penis, the anus, vaginal cancer, even the vulva outside the vagina is what we call the vulva. So you also want to be careful with that. So again, there's just different parts that this cancer can affect. And again, how do we detect this? How can we screen for this? So there's pluses and minuses here. So one, women, usually get a pelvic or a pap smear. And when you get your pap smear done, you get that little brush that goes in there. It's super uncomfortable. Guys, you're so lucky you don't have to do that. A prostate exam is not even close to what a pap is. So you shouldn't complain. But when you get that, what we're doing is we're scraping cells off of your cervix in order to check for precancerous or cancerous cells, and then the HPV virus. So kind of stepping back to when I said there were greater than 200 types of HPV viruses, and I talked about common warts not being cancerous. The reason is not every type of HPV is cancerous, and I hope that makes sense. So what happens is with cervical cancer is when we look for the HPV types, we're looking for the ones that are most prone to causing cancer. So that's why, again, it's important to get that pap. Unfortunately, at this time, there are no screening techniques for males. So again, what a lot of research has shown is that women most likely contract the HPV virus that is cancerous from a male partner that they've been sexually active with. And just to backtrack again, I'm not saying by any means that it's like guys' fault that women are getting cervical cancer. To reiterate, sometimes guys may have like a genital wart or the HPV, and I should say because the HPV virus is what causes it, that they have it, but they don't even know that they have it. So for guys, unfortunately right now, there is no screening technique. We can't like swab your penis like how women get a pap and know if you're carrying the HPV virus or not. The same thing, there is no blood tests for it, nothing like that. So that's why on the guy side, I usually recommend that guys get a skin check, or, definitely take a look at your penis. But if you go either to your primary care physician during your physical, or if you go to a dermatologist, that's a skin doctor, they do very thorough skin checks, because sometimes these lesions can be almost as flat as your skin. So when you're feeling, let's say you're trying to feel your penis to say like, do I have any bumps on here? Does anything seem like a wart? You may not feel it, but again, a dermatologist or your primary care doctor could do that. And I definitely recommend patients, especially guys who, if you've had a genital wart in the past, at least for women, it's good because normally as women, we get paps done on a regular basis, whereas guys usually, don't get down there checked that specifically. But if you have had guys genital warts or anything, you should be following up with a dermatologist anywhere from every 6 months to a year, or as recommended by your dermatologist, just to keep track of that. Because I know if you were diagnosed with human papillomavirus, you don't want to give that to your partner and have them end up having cancer. So you definitely want to be careful with that. So definitely be careful about that. The next thing is there any way that we can prevent HPV? So of course, like I said, one of the biggest things is abstinence. Of course, if you're not rubbing up against anybody, you're not having sexual activity, the chances of you contracting HPV are super duper low. So kind of, again, like I said, other STIs like gonorrhea, chlamydia, again, sexually transmitted. So if you're not having sexual activity, that decreases your risk by a lot. The other thing too is, I'm sure you've all heard, there's a HPV vaccination. They do have it now where it has been FDA approved for both males and females. Patients can get that as early as the age of 9. So again, I'm just giving you this information. It's definitely something that if you want to talk to your child's pediatrician or to your own primary care physician, feel free to, so you can kind of start up that conversation if you would like to find out more information about it. So again, I hope you enjoyed this. Oh my, not the H word, all about human papillomavirus. And I hope what I'm sharing with you has been helpful. Again, if there are any specific topics you want me to cover, definitely feel free to comment below. You can also reach out on drmomshow@gmail.com. Don't forget to hit the subscribe button below on the right hand side. Don't forget to share the video. And don't forget to follow us on Facebook, The Dr. Mom Show. Check me out on Instagram, Deline_Mushalak. Check me out on Twitter and follow along Deline Mushalak also. Thank you again for joining me. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Good night. Thank you. Can't wait to see you again. Love you. Bye-bye.